Hi, good morning. So right now I'm here to perform an incentive spirometry. So I'm going to let myself be the patient and I'm gonna perform the incentive spirometry later on. So first and foremost, before going to the patient's room, we should check the patient's chart to obtain any important information and also for the physician's order. And then once we're going inside, we will wash our hands and then we introduce ourselves to the patient and then explain it to them what's the purpose of the therapy. So shall like what we're going to tell to the patient like hi, good morning, Mr. Smith. So my name is Anthony. So the doctor prescribed you an incentive spirometry. So this one is going to help you expand your lungs, and at the same time it will also aid with your coughing and removing of your secretions. And then once we're done, we also check the patient's ID band to ensure the correct patient, and then we will obtain vital signs and make sure we always auscultate. And then after that, if the patient can sit, we can let the patient sit in an upright position, or if they're not able to do so, we can just either position the patient's bed until we position them the exact way. And then another thing is that when we encounter some patients who just came from surgery, such as from the stomach or chest, shall we say, we can just put a pillow in front of them so that every time they perform, it will aid with some pain that they will experience. So once we going to start, we always have this device, and then make sure we get the appropriate flow for the patient, such as if I am the patient, I will check my age and at the same time my height. So mine is about almost 2000, so I shall set this yellow line at 2000. And then we also have to check if the device don't have any cracks, and then we're going to put the mouthpiece in here. And then every time we perform this is make sure the device is sitting upright in front of you. It should not be like that. And then make sure first is we have to let the patient exhale all the air out until we feel our lungs are empty. Once we feel our lungs are empty, we should put this one in our mouth. It should be sealed with our lips. And then we're gonna take a slow deep inspiration. And then once we're done, we should hold our breath until we notice this white piston to drop to zero. Until that drops, we remove the mouthpiece and exhale normally. So I'm gonna show you my first trial. So first I'm going to exhale my air out. So if the patient is capable to do this, we can do another one, but prior to that, we have to let the patient rest for a few seconds. So ideally, we have to perform this about maybe around 10 times, and then it is also indicated to patients who are cooperative, able to understand, and also it is most ideal to perform during waking hours. And then if the patient, some patients who might feel like any complications like dizziness or something, having trouble with it, we don't have to push it through. And then some patients who are not able to reach this one, we can just start it in the lowest level, and then we can gradually increase it until if they're able to tolerate this one. And then we make sure we document this. And then when doing also this one, after doing this therapy, we have to let the patient cough so that they're able to remove some secretions, especially they're able to they have secretions present. And then after performing this one, we also have to re-auscultate the patient. And then once we're done taking this one up, we have to put this on the safety bag, and then there's also information where we can put the patient's name and room number. And then they can also use this one at home every hour or waking hours, so that it can help do exercise for their lungs and expand. And then once everything is okay, we have to reassess the patient, and what I said earlier, we let the patient auscultate again, and then we have to let the patient cough, and then once we're able to obtain